Now, vaccines to deal with COVID-19 have taken center stage, but there is much going on behind the scenes. Fatima Hassan is a human rights lawyer and social justice activist. She is head of the Health Justice Initiative. She joins us now. Fatima, a very good afternoon to you. Thank you so much for joining us. There are essentially hundreds of COVID-19 vaccine candidates along the various stages of clinical research to assist in the fight against COVID-19. Moderna is one of those on that list. It's a vaccine with its own shortcomings. And we've heard about the specialized deep freeze storage capacity. Is there more to it?
Thanks for having me on the show. So the Moderna vaccine is actually co-owned by the US government. The US government contributed significant amounts of money to actually get the vaccine through the different stages of clinical trials. Moderna, so far, the reports have indicated, and through their own filings and press statements as well, and it's unfortunate that in the last few days they haven't been responding to multiple queries from multiple media houses. But the situation at the moment is as follows. Moderna is not as yet part of COVAX, so its vaccine at the moment is not going to be part of that mechanism. The second is, yes, it is 2 doses, but the storage requirements are less than, for example, the Pfizer vaccine. The third issue related to Moderna is that so far the indications that we have, and they haven't said anything to the contrary as yet in the public domain, is that they will not be entering low-income countries, including countries like South Africa, which means their dossier has not even been submitted on a rolling basis to the regulatory authority in South Africa or elsewhere in low-income countries. And it's definitely not being planned for approval or for regulatory processing in South Africa. They've also not necessarily shared all of the IP and the technology. They said they're willing to do that after the pandemic. We're not quite sure what that means. So that means during the pandemic, where there is the possibility of other manufacturers scaling up that particular technology and that particular vaccine, it's not going to be possible. And this is why civil society around the world is now going to be demanding that the US government actually take action, because essentially they co-own that particular vaccine. And really, we're in the situation where we are on a road to a global disaster. Whoever has the vaccine know-how and the technology, and there's only a handful so far that have been proven to be effective. We're really calling on all of these companies to do the moral thing, to do the right thing, to share the vaccine know-how so that everybody can actually benefit.
With all the challenges that you speak of, discussing the topic of Moderna, you took on opinion leader Peter Bruce, who wrote a scathing piece about government's incompetency over the acquisition of Moderna, saying that he spoke to the company CFO, who confirmed that he could provide South Africa with 40 million doses. But what were your concerns with this information and the manner that it was dealt with in that opinion piece?
So I think the first issue is that Moderna needs to be more transparent. What that indicated was that there was some promise of supplies actually coming into Africa. And that goes against what Moderna has said, and which has been reported on widely in international media, as well as in local media now more recently, that countries in Africa and in the global south are not necessarily a priority for that particular company. So they are prioritizing regulatory approvals in richer nations, and they are prioritizing the base volume of supplies, so the initial supplies in 2021 for countries in the global north and in richer nations. And yesterday, the WHO Director General also confirmed that many companies are prioritizing regulatory approval and then supplies for parts of the global north. Now, what we saw in the last 2 days was that even the EU and the German government are now coming out publicly and saying that even with their commitments of supplies through what we call the AMCs, advanced market commitments, and these were deals that were struck many months ago before the vaccines were actually approved for use in humans, was that there's a major global supply chain bottleneck. So the real question to Moderna, and we really are asking them to be transparent because it's fueling a lot of disinformation and mistrust, is that tell us in an unambiguous way, when will you submit your dossier to the South African regulator? When will you be able to provide supplies, whether it's 10 million, 20, 30, 40 million, to South Africa and every other part of the global south? And when will you make the pricing more transparent, given that the US government was actually a key contributor of the development of this vaccine? Because failing the explicit cooperation of Moderna in this particular global crisis, then the US government really has to step in. The new Biden administration cannot be protecting intellectual property rights, and they have to find a way to rapidly scale up manufacturing.
There were many contradictions about the pricing. How much information is out there and readily available for one to sort of get a sense of how much it all costs?
So there's very little medicine pricing transparency generally, and also with this pandemic, particularly the vaccines that have been co-developed with public sources of funding from whether it's the US government or the UK government or Germany or parts of the EU or other parts of the world as well. So what we are seeing is that there are at least 5 different prices being circulated. Nobody's any the wiser because there's no pricing transparency. COVAX is refusing to make the pricing data available. They're using a tiered classification system. So within COVAX, there's 3 different prices. We saw this last week that the Serum Institute was charging a different price, presumably, compared to what AstraZeneca is actually providing to the EU. We can't be sure because there was a mistakenly issued tweet which showed preliminary prices that the EU was going to pay, which seems to be different to what the US is paying. So at the heart of this is that there's no pricing transparency. And so we can't accurately tell you what the true R&D costs were, what part of it is marketing, what part of it is profit. And, of course, every company wants to get a reasonable return on the investment, but we can't determine what's reasonable or what's truly no profit or low profit if there's no pricing transparency. You just mentioned the compassionate use of Ivermectin that's been approved by SAPA, preliminary reports that have just come through in the last 15 minutes, and this has to be verified by Merck, one of the drug companies, as well as SAPA, the regulator, and the South African government and National Department of Health, that 4 tablets presumably may actually cost 3,200 Rand. So the system is set up in a way where there is very little transparency around pricing. And that is the reason why we're asking all of these different mechanisms, including our own government, to be more transparent about the prices that the public ultimately is going to have to pay for all of these vaccines.
When COVID-19 first hit, there were lots of warnings about vaccine nationalism and excessive profits being made because of the patent monopolies and bilateral deals. I mean, we heard President Cyril Ramaphosa expressing the same concerns of vaccine nationalism, and you also speaking about countries not being a priority, which is a great deal and a matter of concern.
Yeah, and I'm glad the president said it. He said it, about 9 months too late. This is something that activists and many groups have been saying for many, many months. And really, our government shouldn't act like it has no power. It has, lots of power residing in the Constitution and various other laws where it could have taken certain measures to actually address the situation much sooner. So I'm not really making any apologies for government. I think that they've really mismanaged the vaccine acquisition. And you'll remember my organization had actually threatened to take legal action last year already in November if government didn't share the plans. But he is right to point out that multiple countries in the global north are actually hoarding supplies, and that their advanced market commitments made it impossible for COVAX now to meet any of its objectives, meaning that, for example, the AU had to set up its own mechanism to try and find limited supplies. The second issue that's now emerging is that we're entering a round 2 of vaccine nationalism. You've got the EU and, in particular, the German government came out yesterday saying they want to ban exports of any of the supplies because they signed agreements with these companies first, and their citizens should get the vaccine from these companies before it can go to anywhere else in the world. And we saw that about 3 weeks ago with the Indian government, where they had a ban and then the ban was reversed so that our healthcare workers could actually benefit from the serum supply of vaccines that were being manufactured for AstraZeneca. So there's multiple forms of nationalism currently being played out, and it's quite a pernicious form of nationalism. What you actually need is a global equitable allocation framework. So you need to inoculate all healthcare workers in all parts of the world at the same time. What you need to do is focus then on all over 65s. But what we currently have is a situation where, young, healthy people in parts of the global healthcare worker, for example, in Africa. And that is just unfair. But also it makes no public health sense, because it means that you won't be able to reach global population immunity by the end of 2021. So the supplies are an issue. We need to definitely get into the territory of state licensing. The EU has to show, I think, a lot more authority, as well as the US government, to rapidly scale up manufacturing, because there's just too many people getting sick and dying.
And very lastly, a new study came out with UJ, just trying to gauge who would take the vaccine, and a breakdown of the ages. All the figures going around, the 60% of those who are saying they will be willing to take this vaccine. What would you send out as a message of those respondents who say they will take it, and the 40% who simply don't seem to be convinced that this is the right way to go?
Yeah, it's a difficult one, because there's a lot of vaccine hesitancy, and there's a lot of people who don't believe in the safety and efficacy of vaccines. The unfortunate thing is that with the different vaccines that are on the market and the different efficacy levels, we have to inoculate like quite a considerable amount of our population. So if you're not willing to take it, or you're not seriously considering it, it does place the entire country at risk, and people in your community and in your schools. So, this is an issue that I think all of our faith-based organizations, all of our schools, universities, trade unions, other worker formations, and, influential people in South Africa that people actually listen to, including our rugby players, our soccer players, are going to have to come on, more on board, because it's one thing to fight for access to an affordable and sustainable supply of vaccines. But if they're here and nobody wants to take them, then we're just going to have multiple variants and strains to deal with, multiple lockdowns, and it's really going to affect the ability of the world to actually reach, global population immunity quite soon.
And government itself has received a lot of criticism. I mean, there's been questions about the rollout plan, and whether or not it's an ambitious plan, or really something that has no, sort of form when it comes to how the distribution process will happen. What's missing with the information that's out there on the manner in which this vaccine will be distributed, and the many concerns that are being expressed?
So I think, the criticism is legitimate, because I think government is still not communicating effectively and speedily and timeously. And I think there's a lot more briefings that still have to happen. For example, we still don't even know the full funding model. We still have to wait for like another week before those details are going to be shared. There is a lot of private sector involvement and participation through medical schemes and through the private health sector. But, civil society organizations that could actually relay what is happening on the ground, and could also bring a different perspective to how we can encourage transparency in the entire vaccination rollout, I think is still missing. So there is a lot of concern around two aspects of how we're going to vaccinate everybody with limited supplies and global scarcity currently, playing out, and particularly in the EU, is that government needs to be more transparent, and also the drug companies. I mean, today we heard unconfirmed reports that one of the leading frontrunner vaccine companies wants potentially South Africa to sign an indemnity disclaimer, so that there can be no claims against that company if we use that vaccine. So there are a lot of behind the scenes holdups. Unfortunately, these non-disclosure agreements don't, lend itself to greater transparency. So government is definitely in the firing line. But I think that with the same, gusto with which we expect government to be transparent in an open and democratic society, we have to now ask that of the drug companies themselves. And we have to ask them, to share information, not on an optional basis. This is really important for them to share timely information as well, not just on pricing, but also on the sub-licensing arrangements, on the quantities that they can actually provide. Because the worst thing you can do is to give people false hope, to say, of course, we can supply South Africa, but when will those supplies come in? How much will it cost us? Who else are you allowing to manufacture it? Why are you holding onto your intellectual property rights so closely in the middle of a pandemic? So I really think that transparency from all sides is going to be really important, and Parliament has to play a greater oversight role. I think it's just not questioning enough of the executive, and it's not questioning enough of the different private sector and private health sector players that are involved in this particular vaccination rollout, and finally, it has to prioritize the voice of communities who are most affected by this pandemic and the voice of healthcare workers and other workers who are on the front line.
Very well. Thank you so much for your time, Fatima Hassan, founder and head of the Health Justice Initiative. Now,